Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the Pandemic Task Force recommends the removal of community quarantine status in Metro Manila, shifting to granular lockdowns beginning September 8. But Malacañang says it's still up to President Duterte's approval. But some health experts are sounding the alarm over the easing of restrictions as the country records over 20,000 new COVID-19 cases in 3 days in a row. And health workers now getting overwhelmed due to the surge of COVID-19 patients as the healthcare system teeters on the brink of collapse. Will they call for another timeout? Philippine College of Physicians President Maricar Limpin joins us live. Interagency task force has approved placing Metro Manila under granular lockdown starting Wednesday. In separate radio interviews, both Trade Secretary Ramon Lopez and Interior Secretary Eduardo Año said that the guidelines have yet to be finalized and approved by the president. San Juan Mayor Francis Zamora told CNN Philippines the granular lockdown starting Wednesday is a pilot test to determine if these will be effective for the region.
The entire Metro Manila will be under GCQ status, but the areas with high cases will be under granular lockdown. When I say areas, this will not be citywide anymore. It will not be barangay-wide anymore. It will be, for instance, a road, a compound, an apartment, a specific pocket area which has high number of cases. Basically, it is a pilot area. It will be tested in Metro Manila from September 8 to the end of the month. And we will see how effective it will be after a 3-week implementation.
All right, now the number of daily...
Amid talks of easing restrictions in Metro Manila, the country has so far logged over 20,000 cases in the last 3 days. On Sunday, the country logged 20,019 new infections, bringing the nationwide tally to 2,080,984. 173 people died from the virus, while 20,089 have recovered from the disease. In a forum last Friday, healthcare professionals said they were mulling another timeout due to the surge of COVID-19 patients. They also said that they are bracing for the worst. More people must be vaccinated for the country to achieve herd immunity as the infectious COVID-19 variants lower the efficacy of some vaccines. The goal now is to inoculate 90% of the population. Experts back the move but have different takes on the next step. Paige Javier has the details.
Achieving herd immunity remains a challenge amid the limited supply of COVID-19 vaccines. So far, around 14 million Filipinos have been fully vaccinated, a long way from the target of 100 million before year-end. The Health Department raised the estimate to 90% because of the new variants. Health reform advocate Dr. Tony Liachon says reaching the new goal will take a while. He adds, vaccine supply from the United States may be affected by their new vaccination guidelines.
I don't think we will achieve the targeted herd immunity, even the 50% targeted for the NCR bubble for December 21. That is actually precarious at this point in time. That's at risk. So at the rate we're going, I think we will reach the herd immunity about 85 to 90% in 2 years' time. And that may be 2023.
But Liachon clarifies his projected timeline may change if more vaccines arrive in the country. Dr. Rontjean Solante says we need to vaccinate as many people as we can to avoid overwhelming hospitals with COVID-19 patients.
Hopefully by then, before mag-end ng year, makakapagbakuna tayo. Maski 70% before the end of the year, makukuha natin yan. That's already a good sign. And then the first quarter of next year, matapos natin yung remaining population.
Amid talks of booster shots and expanding the rollout, Dr. Benjamin Ko says the focus should be on the initial goal to vaccinate the eligible population first.
If we keep mixing and we keep adding all other variables, children, boosters, third doses, and so on and so forth, it becomes a challenge to get everyone vaccinated.
The government is expecting the arrival of 55 million vaccines between September and October. By the end of the year, the country will have a total of 137 million doses. Paige Javier, CNN Philippines.
We will be taking a short break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. I'm Pinky Webb. Let's go straight to the source of the story. We have Philippine College of Physicians President Dr. Maricar Limpin. Dr. Limpin, welcome to The Source. Thank you so much for your time.
Yes, good morning, Pinky, and good morning to all our televiewers.
You know, we have been averaging about 18,000 cases per day in the past week, and there seems to be no indication that the numbers will go down. In fact, I believe Octa even estimates that the number could increase to 25,000 this week or even next week. The question remains, can the hospitals handle this cases of 18,000 daily average every day?
Well, I think at the moment, no, we are really quite busy in trying to handle the cases as much as we can. No, we exert all efforts in order to be able to help our Filipino people be treated. No, especially if they get COVID-19 infection. But we will still see cases wherein we can no longer admit the patients to the hospitals, to our respective hospitals. So these patients may actually be transferred or will actually be told to look for another hospital where they can be admitted, because many of the major hospitals in Metro Manila are really now full, more than 100% capacity. So actually, that's the main problem that we have right now, and that's why we came out last week to inform everyone, and particularly the government, because the health capacity of the system will no longer be able to really cope up with the number of cases that we have right now.
But do you guys, as doctors, as healthcare workers, think about, pag magpatuloy itong dami ng kasong ito, sabihin po natin at 18,000, because if we were to believe Octa's projection, tataas pa rin po ito. At an 18,000 average case a day, how long will it take before masabi natin na totally overwhelmed na yung hospitals? Because some might not understand, because when they try to bring their loved ones to hospitals, they have to keep going from one hospital to another to try to look for some sort of vacancy.
I did not hear the last question, Pinky.
What I'm trying to say, Dr. Limpin, is at 18,000 cases average every day, can you even tell us at what point will it take another week, or will it take another 2 weeks before the hospitals are actually completely overwhelmed?
I think right now, Pinky, the hospitals are really overwhelmed already, dahil we can actually see people not being able to be seen in any emergency room of any of the hospitals that we have now here in National Capital Region. In fact, marami po doon sa mga tao have to go to as far as Laguna, Batangas, and then as far as the north, Nueva Ecija, so that they can be admitted. So, ang dami talaga, na talagang apaw na ang mga tao, doon sa emergency room. And that is why we really need to do something in order to really bring down the number of cases. Kasi ang worry namin ay mas mas marami pa ang tao na hindi talaga matutugunan namin ang kanilang mga healthcare needs, no? If this number continue to increase, no, in the next few days.
Yeah, but if this starts to increase, I guess that's where I want to go, to even 20,000, 22,000. Papaano na po yung mga ospital ngayon? You know, Dr. Limpin, kasi meron hubang disconnect somehow? Because if we look at the numbers coming from the DOH, in totality, when we talk about ICU beds, 75% utilized na po yan in the Philippines. Pag NCR po, ang nakasulat, 75% utilized ang ICU. We have 1,500 beds in ICU. Kung 75% utilized, ibig sabihin meron po natitira, if I'm not mistaken, 375 ICU beds that should be available. Where are these hospitals in NCR?
Actually, that is the biggest problem I think that we are seeing right now. Kasi yung data that that DOH is coming out with in the past few weeks, no, it does not it is not the same as what we are seeing on the ground. So ang mga ICUs talagang puno, no, and over, no, doon sa number ng beds na pwedeng kakayanin na i-accept, no, doon sa majority of the hospitals in Metro Manila. So baka yung ICU na sinasabi does not includes hospitals that do not actually see COVID-19 cases, no? So definitely, kung if it includes those hospitals, then talagang meron kang 70% na 70% lang ang capacity ng mga ICU hospitals na yan, no? So ang dami-dami ng mga ospital na wala ng ICU. So karamihan yung iba pa na dapat ICU care, no, napupunta din doon sa regular wards, no, yung regular na non-ICU units ng mga ospital na ito, and they are actually being handled and being managed as an ICU patient, pero wala sila sa ICU. So sobra-sobra, Pinky, ang dami ng mga pasyente, no, mapa-ICU man, mapa-regular ward man, o mapa-ER. And it is the ER that is truly reflective, no, of the status of the bed capacity in the major hospitals in Metro Manila.
In fact, we hear a lot of stories of patients even being intubated in the ER dahil hindi pa po sila mailagay sa intensive care unit.
Yes, actually ang emergency room ngayon para na siyang ward na rin, ano, nandoon yung mga pasyente, they are already being treated, they are being managed, at kung kailangan ma-intubate, ini-intubate na, no? There are instances wherein sa emergency room yung mga intubated patients occupied like let us say 1/3 to 1/4, no, nung mga pasyente na naroroon sa emergency room. Well, supposedly dapat pag na-intubate na yung pasyente, kailangan mabilisan, no, maiakyat na yan doon sa ICUs, pero that is not happening because puno na nga yung mga ICUs, and that is what we are saying na hindi nagre-reflect, no, yung data na nakikita natin from DOH. It is not truly reflective of what is happening on the ground.
But that's what I don't understand, Dr. Limpin. Why? Why doesn't it not reflect the numbers on the ground?
Yes, kaya nga importante na dapat digitalize yung yung data collection natin, data recording, no, yung real time, para sa ganon talagang mag-reflect doon sa datos na nilalabas ng Department of Health. Alisin na siguro ng DOH yung mga ospital na dapat na hindi isinasama doon sa pagbilang, ano. So unfortunately kasi kasama pa rin yung mga number ng beds doon sa mga ospital na hindi tumatanggap ng COVID. No, alisin na natin because that is actually giving us wrong information. information. So dapat nga totoong information yung nakukuha natin pero as of now hindi nga natin nakikita yung totoong information.
So, Dr. Limpin, parang lumalabas po, if there's 25% na available na ICU beds, what you're saying is this 25% may be ICU beds for other illnesses and not COVID.
Yeah, maybe, yes. It may be for other illnesses and not COVID, Pero again, Pinky, on the ground, this is what is happening in the hospitals na kahit yung supposedly na bed meant for non-COVID, na-occupy na rin yun ng COVID cases, So kasi wala na nga magawa ang ospital, Wala na kaming magawa except to really admit as much patient as we can para matulungan namin yung mga kababayan natin. Pero syempre hindi naman namin pwedeng ibigay lahat, yung dapat na mga beds na yan dahil marami din naman kaming tuloy-tuloy pa rin ang pag-admit namin ng mga pasyenteng hindi COVID, So we are now faced with the reality na hindi namin pa pwedeng basta COVID cases lang ang aming ina-admit, So we also have to admit the non-COVID cases, lalong-lalo na yung mga cases that really need healthcare, Katulad ng mga inaatake sa puso, na-stroke, So yung etong mga non-COVID cases na ito, this is also occupying the hospital.
We need to find out the state of our healthcare workers, but we will take a very short break. The Source will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Philippine College of Physicians President Dr. Maricar Limpin. Can you just give us more details or describe to us the state of our healthcare workers?
As far as the healthcare workers, particularly the doctors, marami kami, may mga ospital na nag-report na marami sa kanilang mga doktor ay nagkakasakit na rin, So actually, meron silang COVID-19 and therefore, itong mga doktor na ito, that means na hindi ito makaka-report, to duty. They will be placed on quarantine. And then, syempre, lahat din ng mga tao na na-expose doon sa mga taong ito na nagkaroon ng COVID-19 will have to be placed also on quarantine, So that actually depletes the number of healthcare workers that we have in the hospitals. Idagdag pa natin yung mga nag-resign din, So maraming nag-resign and actually we've heard na nitong nakaraang araw na may mga doktor na rin na tumigil na, So ito yung lalong-lalo na yung aming mga residente, May mga tumitigil na diyan. Marami sa kanila dahil may mga reklamo din sila tungkol sa mga benepisyo nila at saka natatakot, Natatakot doon sa sitwasyon na nangyayari ngayon regarding our COVID cases.
Would you be able to give us a number of those who have been infected? You said doctors in major hospitals who have been infected lately at yung pong residents who possibly do not want to work at this time because natatakot na po sila?
Well, mayroong report na like let us say sa isang hospital. I'm not going to say anymore what the name of the hospital. Pero like let us say yung lahat halos ng mga bata nila, ng mga bata na residente hindi nag-report to duty for the past 2 days, So 2 araw na yan na hindi nag-report. So medyo that is actually an area of concern para sa amin, Dahil sa bakit biglang hindi pumasok. And ang narinig namin dahil sa hindi nga sila nakakatanggap ng benefit. Yung benepisyo daw na supposedly dapat na natatanggap nila. And then meron namang isang ospital na like let us say 5 na sa mga doktor nila ang nag-positive, And alam mo pag 5 yung nag-positive,
Madami po yun.
This means na marami yon at kasi magiging mas madami pa yung number na kakailanganing hindi pumasok dahil sa etong mga ibang tao na ito ay they have to be isolated, So important So, yung 5 yun, hindi lang siya 5, maaaring aabot yan sa 15. Bukod pa doon sa mga nurses, saka yung ibang kasamahan pa namin na na-expose din sa 5 doktor na ito. So, in a hospital kapag gano'n, no, parang medyo parang medyo disabled ka ng konti dahil sa definitely malaking kakulangan yan doon sa health workforce natin.
But the hospital you were saying, you did not want to identify this hospital na 2 days na pong hindi pumapasok yung kanilang mga doktor doon. Is this a private or government hospital, and is this located in Metro Manila?
Yeah, located in Metro Manila. It's a private hospital. It's a big hospital, no? It's a major hospital in the National Capital Region. So malaking concern ito kasi ibig sabihin madideplete, no, yung mga health personnel natin that is really fighting on the ground.
Right. Just to press on this, when I think about major hospitals in Metro Manila, I can think of about 3. Medical City, St. Luke's, and Makati Med. Would it be one of those?
Hindi, I cannot. Marami pa naman, no, bukod doon sa tatlo, no.
Sige
so,
po.
So marami tayong malalaking ospital dito sa National Capital Region. So definitely may mga problema tayo. Tapos halos lahat din sa major hospitals na yan, meron ding mga nagkasakit na ng COVID-19. So talagang sa bukod doon sa kakulangan sa mga beds, no, we are also now encountering problems as to the active, no, health workforce na nagtatrabaho doon sa mga hospital na ito.
Dr. Limpin, what will push our healthcare workers to once again ask for a timeout? Kasi pag-isipin po natin, and just to follow up that question, we're running out of time. What are your thoughts on this granular lockdown? Do you think this is a good idea? Will this help? Or hindi po ito makakatulong sa hospital patients going into hospitals and the healthcare workers taking care of patients?
Yes, Pinky, the mere fact na nagtawag na kami ng press con last time, and we are already calling on the government and yung mga tao, no, na tumulong na sa amin dahil talagang overwhelmed na ang healthcare system natin. That means that nag-expect kami ng mas matinding measures, no, na ipapatupad, no, dito sa National Capital Region kasi talagang overwhelmed na ang mga manggagawa na pangkalusugan. As to the granular lockdown, I still have to see whether this is effective or not. May mga nangyaring granular lockdown dati pero hindi naman natin nalaman kung effective o hindi. Number 1, that means na walang papasok, walang lalabas doon sa mga lugar na ito. Pero alam naman natin na dito sa National Capital Region, ang mga tao ay hindi necessarily na nagtatrabaho lang within the local government unit na kung saan naroroon sila. They can probably be crossing other LGUs, no? So ang magiging problema diyan, how will we be able to effectively implement yung granular lockdown yan? It also means na kailangan mo ng mas maraming tao para mapatupad mo yung granular lockdown na yan. And then additionally, at the end of everything, kailangan masiguro mo ng lahat ng tao hindi mawawalan ng trabaho at magkakaroon din sila ng mga support, financial support, no? So yun yung mga problema in the implementation of granular lockdown. And of course, hindi ko pa also saying na we do not have any evidence, no, as to whether these granular lockdowns are effective. What has been shown so far Kailangan ang lockdown, kailangan tunay na lockdown ang gawin natin. Not the lockdown that we saw this August 6 and to August 20. Hindi naman tunay na lockdown yun kasi ang dami-dami pang tao na nasa labas. No? So that's why hindi natin nakita yung tunay na epekto ng lockdown nitong nakaraan.
We wish to speak to you again at another time. Maraming salamat po sa inyong oras sa Philippine College of Physicians President Dr. Maricar Limpin. Take care.
Yes, thank you then, and take care everyone. Stay safe.
Thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.